viewers, I am Adiba Siddiqui from Integral Institute of Nursing Science and Research. The video we are going to watch will aware you about early detection and prevention of cervical cancer through VIA and VILI. During the video, we are going to hear many questions from different medical colleagues, and at the end of the video, we will ask some questions to you to know whether you are getting some answers from watching this video or not.
What is cervical cancer?
Cervical cancer is a disease in which cancer cells grow in the cervix. The cervix is the lower narrow part of the uterus which connects the vagina. Every year in India, 1,022,844 women are diagnosed with cervical cancer and 67,477 die from this disease. According to registry data, at least 18,600 cases of cervical cancer are reported in Uttar Pradesh in a year, which is about 15% of all such cases reported annually in India.
Who are those at risk for cervical cancer?
Women at risk for the cervical cancer are having sexual activities at younger age, having multiple sexual partners, giving birth to too many children, poor vaginal hygiene, early marriage, women who belongs to poor family, and women not going for pap smear test.
What are the signs and symptoms of cervical cancer?
The signs and symptoms of cervical cancer are pain during sexual intercourse, abnormal vaginal bleeding, body weakness, pelvic pain, leg pain, back pain, and unusual vaginal discharge.
What is the diagnostic and investigation of cervical cancer?
The diagnosis for cervical cancer are history collection, physical examination, pap smear test, screening for VIA and VILI, colposcopy, blood and urine test.
What is the prevention of cervical cancer?
Preventions for the cervical cancer are HPV vaccination, screening by VIA and VILI, avoid early marriage, avoid smoking, avoid having multiple sexual partners, practice safe sex, eat balanced diet, and good vaginal hygiene.
What is the management of cervical cancer?
The treatment for cervical cancer are surgery, radiation therapy, chemotherapy, and biological therapy.
What are the step-by-step for performing VIA and what is VIA?
VIA, visual inspection with acetic acid, is a naked eye examination of the uterine cervix. After the application of the 5% of acetic acid, the interpretation of the result is in 1 minute. This is a simple and inexpensive test for the detection of the precancerous cells and lesions of invasive cancer. The result is immediately available and there is no requirement of any laboratory assistance. A small container, 5% vinegar acid, 5% acetic acid, gloves, cotton swab and vaginal speculum. Wash your hands and put on gloves. The woman needs to lie down in lithotomy position while her legs are supported on the table. Before you insert the speculum, you have to examine the external genital area for any sexual transmission disease or any abrasions. Then insert the speculum gently into the vagina. You do this by holding the speculum blades together and sipping them into the vagina. Be careful not to press on the uterus because this area are very sensitive. Gently open the blades and put into the cervix. Move the speculum slowly into the vagina until you can see the entire cervix. Lock the speculum into the open position. If there is secretion on the cervix, gently wipe them off with the cotton swab. Using a new cotton swab, next you need to apply 5% vinegar or acetic acid on the cervix. You need to soak the cotton swab into the vinegar or acetic acid, and you need to apply that direct into the cervix and leave the cotton swab resting on the cervix for full 1 minute. Immediately after removing the swab, observe the cervix for any white lesions. SCJ junction is the intersection between endocervix and ectocervix. It is where abnormalities start. Normal cells remain pink after the application of acetic acid. Once you finish your observation, you need to withdraw the speculum gently and discard the waste product in a plastic container.
How can we know VIA positive and VIA negative?
This is a normal cervix. It has been giving a negative result. Notice that it has a healthy pink color, clear mucus coming from the cervical, and no acetone white area are seen after applying VIA. This is a precancerous cervix. You will notice that it is reddish in color, there is acetone white changes, and they are well clearly demarcated, and there are picacy to white area, which indicates that it is a VIA positive test.
What is BILI? What are the steps of BILI, and how can we differentiate between positive and negative BILI?
VILI, visual inspection with lugols iodine. The procedures for the VILI is as same as the VIA, but instead of using acetic acid, we use lugols iodine in this procedure. We perform VILI screening to confirm the VIA result. This is a positive result using lugols iodine. You will notice a yellow-white lesions with no iodine uptake in the anteriorly columnary junction. This is a negative result of cervical cancer in VILI. There are patches, scars scattered all over the cervix with no iodine uptake. Normal cervical epithelium environment usually appears brown in color.